Welcome to Module 3, where we will be discussing gestational diabetes. We will be talking about what diabetes is, specifically gestational diabetes, what insulin is, how gestational diabetes is diagnosed, how to manage it, what the glycemic index is, how to balance a snack or sweet so it doesn't spike our blood sugar, and some other dietary management options. So what is diabetes? There are two common types of diabetes, type 1 and type 2. You might see them listed as T1DM or type 1 diabetes mellitus or T2DM type 2 diabetes mellitus. Type 1 is complete pancreatic insufficiency, meaning our pancreas is not secreting any insulin. This is an autoimmune disease and is genetic. Type 2 is caused by insulin resistance and sometimes advances to pancreatic insufficiency. This is usually caused by poor diet and exercise, as well as some genetic factors. All pregnancies are a state of glucose intolerance, but some advance to gestational diabetes. Gestational diabetes is not the fault of the pregnant individual. It can not be 100% prevented. But there are still some factors that put someone at a higher risk. For instance, having a high A1C level in early pregnancy. A high A1C level is a marker that measures blood sugar over a period of 3 months. As well as not having good exercise and diet can put you at a higher risk as well. Gestational diabetes mellitus might be noted as GDM at times. It impacts 7% of pregnancies, and it is diagnosed ideally between the 24th and 28th week. It puts the pregnant individual at a higher risk for having a baby that is large for gestational age or a big baby that might put you at a higher risk to have a C-section. Infants may also require additional glucose after birth because they're used to such a high glucose environment inside the womb. It might also put the infant at a higher risk for type 2 diabetes later on in life. 5 to 10% of those with GDM develop type 2 diabetes right after birth. 40 to 50% develop it 5 to 10 years after birth. But as soon as you give birth is when you stop having gestational diabetes, or shortly after. There are two different types of ways to diagnose gestational diabetes. One is a single step, a 75-gram oral glucose tolerance test. You do have to be fasting for this test, and you have to take a 75-gram glucose drink called glucola. If you're diagnosed, then you had 2 or more high levels. You are sampled at fasting 1 hour and 2 hours. The other way is a 2-step process that has a screening ahead of time. You have to drink a 50-gram glucose drink, and then 1 hour later you are measured. And if your blood level is above 140 milligrams per deciliter, then it is considered impaired, and you need to go on to the 100-gram glucose drink. For the screening, you do not have to be fasting, but for the 100-gram tolerance test, you do have to be fasting. And again, if you have 2 or more numbers that are high, you are considered to have gestational diabetes. You are measured at fasting, 1 hour, 2 hour, and 3 hours. So what is insulin? Insulin is a hormone secreted by your pancreas. Your pancreas is an organ in your body that helps manage endocrine functions like secreting hormones. Insulin is like a key that opens the door to help glucose in. So if you don't have that key, the door won't open and the glucose stays in your blood, which is why you might hear that your blood glucose levels are going up. It's because your insulin isn't wanting to open that door. Managing gestational diabetes. Your doctor might recommend you monitor your blood sugars using a glucose monitor and take medications. Some other things you can do is try to focus on proteins and healthy fats in your diet, and eating high glycemic foods with a low glycemic food, as we'll talk about more in a second. You can also try to exercise. Aim for 30 minutes of moderate exercise per day, as exercise can actually help you process sugar even if your insulin isn't wanting to do its job. The CDC recommends at least a minimum of 150 minutes per week. The glycemic index. The glycemic index quantifies the impact a food might have on your blood sugar. A high glycemic index food implies a high glycemic load, which means that it's going to impact our blood sugars greatly and spike our blood sugar, and then it will drop. Low glycemic index implies low amounts of simple sugars and higher amounts of proteins and fibers, and it might rise our blood sugar a bit more slowly and stabilize it over time. If you combine these two foods, you might have more of a medium glycemic load, which is much better than a fast sugar spike. Here's a list of some foods and their glycemic index. As seen in general, the items with simple sugars are going to be having a bit more high of numbers versus something that has some protein or some fiber along with it will have lower levels. How to make a balanced snack. You want to try to combine some fiber and protein along with anything that you might be wanting to have that has a little bit of simple sugars that might spike that blood sugar. Some examples might be chocolate and a Havarti cheese. Chocolate is a great option because it already has a little bit of fat in it. Apple and peanut butter. Cookie and peanut butter. If you're wanting to get some sweets in there like a cookie, try to mix it with a nut butter or some other protein source. A sweet along next to a protein shake. Some Greek yogurt with your pretzels. Some chocolate chips along with some peanuts. A piece of fruit with cottage cheese, and maybe some chips and bean dip. Other ways to manage gestational diabetes include utilizing the MyPlate and carb counting, which we'll talk about further in the next modules.